Thank you very much for clicking onto this link. The presentation you're about to see are for those staff who are unable to attend the Pedic briefing workshops. The presentation was delivered by myself, Ray Johansson Chapman, and Susan Holton and Humphrey Ball from Freedom Health. Okay, the first slide is quite a lengthy slide. It's patient and public involvement in a nutshell, and there'll be a load of terms on there that you've probably seen, and I'm going to try and give a brief description of what they mean. So the first one is patient and public involvement, often abbreviated to PPI. And what patient and public involvement is essentially around is ensuring that the NHS or the hospital or public sector per se involve patients, clients and the public in the development of services that we provide and to help design better outcomes for those services. You've probably often seen the next three terms, which is patient satisfaction, patient outcomes and patient experience. What does patient satisfaction mean? Well, here's a definition. It's an evaluation of what happened on that journey. It's about reporting the patient's feelings about the experience of care, usually requiring patients to give an overall rating against a series of questions based on the whole service experience. So that's patient satisfaction. Well, patient outcomes are defined in two ways, and that's reported outcomes, defined outcomes. Patient reported outcomes as patient's perspective on whether a treatment or care received has improved the quality of their life, whereas patient defined outcomes are where patients are involved in the design or measure of a particular service or treatment that they've worked at, service that they've worked with, or treatment that they've received. Now, patient experience is a little bit more tricky to define, so I'm going to try and give you a definition now. Patient experience, what does it mean? Well, it's a direct experience of where a patient service user can clearly define particular aspects of a treatment or care they've received which closely relates to and influences clinical effectiveness and safety. Okay, the next bullet point is Pedic. What does Pedic mean? Well, Pedic stands for the Patient Experience Data Intelligence Stroke Information Centre. What is it? Well, it's both a system and tools that are utilised to collect patient experience satisfaction. So the system is where all patient satisfaction data is uploaded into, and from there we are able to assess and analyse those results. The tools are the Pedic survey tools, where are essentially a range of options to undertake a Pedic survey either on paper, online or through electronic devices. Freedom Health is the organisation we work with, and I'm now going to ask Humphrey Ball to tell us what and who Freedom Health are.
Freedom Health is an independent company that specialises in generating and processing patient feedback. We've been part of the Pedic since its inception in 2010.
This next slide, following on from patient experience, patient satisfaction and patient outcome, is about the structure of patient and public involvement in SLaM. The trust-wide PPI team sit within the Strategy and Business Development Directorate. What do? Well, we do a whole range of things, but for this particular purpose, we manage, monitor and report on patient experience, i.e. Pedic surveys. But do bear in mind, we do lots of other things. The PPI team consists of Dr. Ray Johansson Chapman, Susan Holton, Neil Philgate and Bill Berry. Patient and public involvement much more locally within SLaM. Each CAG has a member of staff who has responsibility for patient and public involvement. That may not be their title of their particular position, it may be for some, but not for all. The staff responsible for PPI are as follows. In addictions, it's Dr. Kim Clark. In B&D CAG, Regan Edmiston. In mental health, older adults, Nuala Conlon. Psych Med and MAP, Alice Glover. And last but not least, in psychosis CAG and Kirby. Their job, part of their job actually, is to support teams to respond to Pedic survey results.